Welcome to Nursing Care Essentials, where we talk all things nurses, all for my new grad nurses and for my student nurses, right? And for anyone who's looking for nursing resources, I'll say. All right, so on today's topic, we're going to focus on an A to G assessment, okay? So in A, it's airways. So you need to check like the patency. If your airway is patent, if there's no obstruction, if your patient is talking to you. B, we're checking their breathing. So how is their breathing, right? So we're gonna check their saturation, we're gonna check their respiratory rate, we're gonna check their depth of breathing, retraction, use of accessory muscles. Moving on to C. C will be your circulation. So it's important for you to check your blood pressure and your heart rate, all right, and feel your patient if they're warm or if they're well perfused, and you can do your cap refill and see if your blood pressure is within the normal limits, okay? And you can check their tongue as well if they're dry, all right? And you can ask the patient when they last had a drink if they're not nil by mouth. Right, and moving on to D. So D, you are looking for a GCS. Is your patient alert and oriented? And if not, what is the problem? Identify what the problem is. And for our patients that in the hospital where I work, we do like a delirium screen, mostly done for patients that are over 65. If they are confused, you need to find out, like maybe from the immediate family, is that confusion like their baseline, or is it like a new confusion? And also in terms of D, just ask if they are in any pain, and you need to assess the type of pain. And moving along, how do they mobilize? Because you might have to mobilize them at some point, and any form of disability. And then E, you've got your exposure. So exposure, it will be mostly checking your temperature, checking if they've got any form of device accesses. That can include a cannula, that can be an IDC, and you need to assess the size of those device access, or if they've got a PICC line, and you need to check the dressings, how long has those devices been there for, and find out what are we using them for, because at times you receive patients usually from ED with IVC cannulas, and we need to find out, do we need to keep that device access in? If not, because it can be a site and source of infection, it needs to come out. Depending on where you work, our policy is any IVC that's coming from ED needs to, if it's in the cubicle fossa, it needs to come out within 24 hours. But that goes back to your organization where you work. As you're checking all those devices, also do, I'll say, especially for the older people, check the sacrum. Some people, they will come in with pressure injuries. It is good practice for us nurses to do like a skin assessment and record every bruise and every pressure injury that a patient has when you accept the care. Remember, nursing is all about covering yourself, so please do that. All right, and also with the elderly patient, you might want to get them like an air mattress or a mattress that will help to relieve the pressure injuries. And F, it comes back to fluids. If the patient is nil by mouth, or if they are on food and fluid charts, are we monitoring? Going to G, we are going to look at glucose. So that's for all your patients that diabetic, whether type 1 or 2. Nice. That's a very important assessment. Every nurse needs to do like an A to G assessment. Okay. All right, I'd like to say thank you for watching. If you are interested in seeing more videos, nursing, explaining nursing concepts, or if there's anything that you are interested or that you want me to cover, please let me know in the comments. Don't forget to like, subscribe, share, and yeah, come back for more. Thank you.